What are the advantages and disadvantages of being a rural doctor?
Hello.
Hi.
Okay. So I'd like to start off by talking about the advantages of being a rural doctor. So I think there are many. So first, you get to have a lot more independence in your practice. So it's more likely that you'll be on your own, making a lot of decisions. You really have to expand your clinical acumen, be able to do a lot more procedures and things that you may not get to do. In a metro community. For instance, like maybe removing skin lesions or doing ECGs or even dealing with traffic emergencies and things like that. That would happen if you're a solo rural GP or something like that. I think another benefit is strictly monetary, that the government actually incentivizes rural positions more than metro positions. So there's an opportunity to potentially earn a little bit more money. I think another benefit is that just the lifestyle, I think, is very different. You have the opportunity to have a bit more peace and quiet, have a bit more land, get into like agriculture and potentially livestock, if you want horses, things like that. You might get to appreciate a bit more of the natural beauty of an area. And you don't have to worry about issues like pollution and other things. Another small advantage I see is that you can potentially see a slightly more diverse range of patients with sort of, I guess, just a different type of condition they'll come with. I think rural people are more likely to present slightly later with more serious issues, with a wide spectrum from mental health issues to injuries to all the usual chronic diseases that we think about when we think about medical practice. Mm-hmm. Some of the disadvantages, I think, ironically, independence is a disadvantage as well. You can feel isolated and on your own in your clinical decision making. Second, a limitation of limited resources. You might not be able to get the certain tests, scans, blood results that you would like. And that may limit your ability to make the right decisions. I think three, there's a lot of responsibility. You may sort of never have an off switch because if someone has an emergency in your town and you're the only doctor, then you're kind of 24 hours on call. And you may have that, excitement to do that in the beginning, but 15, 20 years down the track, you'd be significantly fatigued that you're expected to always be available to everyone to help. I think another disadvantage is just the isolation from potentially family and friends. Now I'm thinking that of someone who's come from a metro area and gone to a rural area. That means that you're quite far away from all the traditional support networks you have in a metro area. But it's obviously a bit different if you're from the town. So that's, I think, a sort of broad spectrum look at some of the advantages and disadvantages of being a rural doctor.
Thank you.
Cool.